Hello everyone! Today we will show to you integral spine correction methods using the Cordus and Sacrus devices, which you might be familiar with. The greatest thing about integral methods is that we use a comprehensive approach and treat the spine from the neck to the coccyx. Why is this important? People often come with a problem like hernias in the neck or the lumbar region, or sciatic nerve entrapment. However, if we study the MRI of the entire spine carefully, we will see that it is unusual to have a hernia in the neck and the rest of the spine in perfect condition. Usually, when there is only one serious problem, there are also 2 or 3 problem areas. Thus, if we want to make the therapy efficient, we should focus not only on eliminating the pain, but also on the recovery of normal spine mobility and flexibility. This is the desired feeling that you and many others want to get back, and it can only be obtained through a comprehensive therapy of the spinal column, sacrococcyx.
Позвоночного столба и, собственно, крестца и копчика, мы достигнем такого результата.
Besides, if we focus on some chronic conditions, as we've been doing recently, we can see the Sacrus Physio device. As you can see, it has electrodes. It works in 2 ways. The first is vibrotherapy, where different vibration modes help relax muscles, ligaments, and joints. This is especially important for the treatment of pelvic and sacral bone areas. The second is the stimulation current therapy. It is crucial for the recovery of impulse conductibility along the nerve fiber. Compressions often cause paresthesia, which often comes with conductibility disorders. With the stimulation current therapy, we can safely and efficiently recover it. Besides, the stimulation current therapy helps the nervous system to relax and promotes its recovery, which is beneficial to the entire body. So the best bundle is Cordus together with Sacrus Physio. Now let us show the integral methods, explain the procedures, and list the factors that can be crucial during the therapy, especially if you have hemangiomas, cysts, Schmorl's nodules, and other scary words denoting things in the spine. Before spine correction, we recommend you do some easy exercises to warm up the core muscles. You can try the cat position, and then arch and bend your spine up and down. Right. Head down, now arch up, and then bend down like a cat, and your head goes up. This exercise can suit almost everyone, even those with large hernias. A more advanced variant involves some rotation, or shall we say, the circular movement of the spine. Personally, I prefer circular movements because they involve the muscles that rotate vertebrae. This exercise is very beneficial for those who have scoliosis of any degree, because it also involves oblique abdominal muscles, as well as the vertebra rotators.
И после этих упражнений
After
можно,
these routines, you can squat on your heels and stretch like cats or dogs do.
Кошки либо собаки. Вот, на выдохе хорошо, даже в грудном
Breathe out
хорошо
and
прогнуться,
bend in the chest area.
что очень
It is very good for those with
является
kyphosis,
для лиц
slouching.
с кифозом, ну или сутулостью. Вот.
Keep this
Здесь
position for about 20 seconds.
20. После чего вы можете уже
And then you can start with the deep comprehensive correction of the spine.
комплексной коррекции позвоночника.
We will start our therapy with the sacrum. Take your sacrus, or sacrus physio,
Вот.
and
И
place it on the
начинаем
sacrum
его
area.
касаться. Для этого надо
To do this, you need to lay on the right side and feel for your sacrum. Initially, you may feel protruding vertebrae in the lumbar spine.
Да, и вот когда вниз будет
Go down
идти,
then,
всё здесь
and you get to your sacrum.
найдете.
It is a hard, bony area. Place your sacrus on the sacrum area,
Достаточно плотно.
and as it clasps tightly around your sacrum,
Плавненько на него
roll
опирайтесь.
over on it.
Единственное, что вам надо будет
One important
концентрировать
thing,
его
you
положение,
need to
чтобы
keep it central
бедро
so that your
не было
hip did
направлено.
not tip left or right.
Всё, ножки выпрямляем.
Unbend your legs, and now you are ready for the sacrum therapy.
С терапией крестца
We will do 3 exercises.
3 упражнения.
Keep your legs unbent and relaxed. Put them on the heels.
На пяточки ставить.
Yes, this way.
Вот. Все, можно даже, ну, здесь мы демонстрируем.
Here we show it in trainers, just for the better looks. At home, you would normally exercise without shoes, and your calves would touch the floor.
Вот, и благодаря этому ваши икры будут полностью касаться пола. В среднем коррекция каждой зоны проходит около 3 минут. Это связано с тем, что
On average, the treatment of each area takes about 3 minutes, because if you stimulate proprioreceptors with the device for 2 to 2.5 minutes, your nerve center that keeps the muscle in hypertension gets tired, which can lead to myospasms. So 2 or 3 minutes is enough to get tired. The muscle tonus reduces and the muscle relaxes. Then the muscle stretches a little, and nerve or disc compressions are reduced or even disappear if you place Cordus near them. That's how we get these 3 minutes. You keep sacrus under your sacrum,
Сакрус у нас остается под крестцом. Если вы используете сакрус физио, то, разумеется, вам надо...
and if you're using sacrus physio, you should be in your underwear to ensure good skin contact, because the device treats you via the electrodes that must contact your body. After 3 minutes, we do the second exercise to treat the pelvis. Bend the knees and place your feet at shoulder lengths. Keep your knees together to form an angle. You will feel this position allows the device to treat the higher part of the sacrum. When your legs were unbent, we mostly treated the coccyx area and up to the mid-sacrum, and now from the mid-sacrum to the lower lumbar region.
То есть, когда ноги были выпрямлены, мы в большей степени воздействовали на зону копчика и до середины крестца, а сейчас от середины крестца до нижней части поясницы. Кстати сказать, если у вас
If you have a hernia in the lower back, L4, L5, or L5S1, this procedure will be very good for you, because working with the sacrum and the lower back helps remove disc compressions and relax the pelvis. It also helps reduce or even eliminate the sciatic nerve compression. You may not notice the effect of the therapy after the first session. It works well after 5 or 6 sessions, so you need to take your initial condition into account. If you started having back pains recently, 3 to 5 sessions might be enough for you. If you've been having these pains for 5 to 10 years, you may need a course of 10 sessions, then taking a break, and then about 2 or 3 sessions a month. If you have a chronic condition like sciatic nerve compression, hernia, or regular back pains for over 10 years, you need to prepare yourself for 2 or 3 months of therapy. Use a 10-session scheme.
Если же у вас хроническая проблема, то есть у вас защемление седалищного, грыжа или вообще регулярные боли в спине на протяжении более 10 лет возникает, то, соответственно, надо ориентироваться на 2-3 месяца терапии, курсами по 10 сеансов. То есть проводите 10 сеансов.
First, you take 10 sessions over about 3 weeks as you exercise every second day, and then rest for 2 weeks and repeat the course. This way, we can really improve our spine condition and gradually reduce hernias.
Так, вот у нас приблизительно сейчас как раз 3 минуты прошло.
Right now, we've done it for about 3 minutes. The third sacrum relaxation exercise. You need to put your feet together and spread your knees, almost like the butterfly position in yoga. Of course, very few people can spread the legs with the knees touching the floor, so you can do it as far as you can.
Так что делайте в меру своих способностей. Данное упражнение дополнительно очень хорошо выполнять женщинам.
The exercise is especially good for women because it helps unload hip joints and even center hip joints in the cotyloid cavity. If you want your therapy and treatment to go well, try breathing a bit deeper. Let's show it, Marina. Yes, with the belly. Right. Great. Breathe deeper for about 3 seconds. Breathe in slowly, then breathe out for about 3 to 4 seconds. If you breathe out longer than you breathe in, 4 to 5 seconds, for example, you will engage your parasympathetic nervous system and calm down your heart rate, promote relaxation, and improve blood circulation through the relaxation of blood vessels, especially in the limbs. This is what your breath and the device do.
Чему способствует и ваше дыхание, и особенно терапия аппаратом. Ну как тебе, Марин?
How are you feeling, Marina? Good. Good? That's great. You see, we don't lie. Marina is feeling good. You can feel your muscle relax in the pelvic area, your bloodstream intensify, and your feet feel warm. Some may feel other things like goosebumps. All of these are normal and mostly pleasant. Sometimes chronic conditions may escalate and result in some minor pains in knees, feet, and hip joints. This is how your body reacts to therapy. It tells you where you still have problems, what areas you should pay more attention to.
Отзывается организм в ходе терапии, он показывает, собственно, где еще есть проблемные участки, намекая вам на то, чему стоит дополнительно уделить внимание.
I'd like to tell you more about the treatment of pelvis and lower lumbar spine for those who have listhesis, retrolisthesis, or antilisthesis, or in other words, vertebra dislocation to the front or the back of their lumbar spine.
То есть смещение позвонков кпереди либо к сзади. В этом случае, когда вы проводите
When you want to relax your sacrum area, let us show you. You will need a cushion of about 5 centimeters thick. You can roll up a towel, then lift your pelvis and put the cushion under your lower back, and then place the sacrus under the sacrum. In this case, the therapy will be more beneficial and efficient for you. You don't need to have a listhesis to use the cushion in the sacrum therapy. If you are over 45 and you have significant pains in the lower back, It can also improve the therapy.
выраженные боли в пояснице. Это тоже будет способствовать улучшению терапии. Теперь, в некоторых видео раньше мы показывали, что
In some of the
максимальный эффект
previous
можно
videos,
достичь.
we showed that the best effects can be achieved. Osteopathic physicians discovered it in their practice when we combine the sacrum therapy with sacrus and the application of cordus under the lumbar region. To this end, you need to remove the cushion, take your cordus, and apply its L side, the widest one, a bit lower than the middle of the lumbar region.
И да, также расположить приблизительно под середину поясницы. Повторюсь, что
Once again, it can only be useful if you do not have any lumbar listhesis. If you have a hernia or a protrusion, you can do it, but only starting with the 5th or the 6th session. You mustn't rush with the comprehensive therapy, as with any other treatment. You can put your arms along the body. Here, we place the arms above the head just to let you see where cordus is placed.
чисто для того, чтобы вам было хорошо видно, где располагается кордус. Итак, повторюсь, если
I
у вас
repeat,
есть протрузия
if you have
ниже
protrusions or hernias in your lumbar spine,
сеанса, вы можете
starting with
использовать
session 5 to 6, you can use both sacrus and the cordus under your low back simultaneously. If you have a listhesis or a hernia in the mid-lumbar region that is over 6 millimeters in size, you'd better take the treatment in stages rather than combine the two devices together. Now we'll show you how to combine the devices for the neck therapy.
два аппарата вместе. Вот, далее мы также покажем, как совместить их при терапии шеи. Вот. Здесь оптимально хочу отметить
In this case, positioning your legs at an angle is the best because it conditions the proper lordosis with a slight curvature to place the cordus tighter. Besides, this leg position is very comfortable for the comprehensive therapy with sacrus. This is how the treatment is applied for 3 minutes, after which you can remove cordus, and if the total time with sacrus is 9 minutes, you can remove sacrus as well. We have already used sacrus to treat all of the positions, so it can be removed.
А если суммарное время с сакрусом составило 9 минут, то можете убирать и сакрус. Вот в нашем случае мы уже сакрусом проработали все позиции, так что сакрус можно убирать. Для удобства
For your convenience, we'll show you how you can remove the device from under the sacrum. Some people have problems lifting their pelvises to remove the device. To do this, you can just flip to one side and simply take sacrus out with your free hand. Put it away and return to the initial position. Your legs can be bent.
достать сакрус, отложить его в сторону. И дальше вернуться в исходное положение. Вот, ноги могут быть согнуты. Да, сейчас, так как мы с вами таз проработали.
Since we've already worked with the pelvis and the lower lumbar spine, now we will combine the therapy, and then you can put the devices away.
Совместим стопы.
After we relaxed our sacrum and the lower lumbar region,
Да.
we can carefully mobilize them.
Итак, теперь
You can do that even if you have sciatic nerve compression or hernia in your lumbar spine.
поясницы можем выполнить легкую и мягкую мобилизацию. Ее можно даже делать в случае и ущемления седалищного нерва, и наличия грыжи в пояснице. Выполняем
Let's do some careful twists.
Для этого
Pull your knees to the floor on one side,
прямо до пола.
lock your hands together at the chest level, and twist to the other side.
И в другую сторону
Your head and chin also turn to the side opposite of the knees.
делаем это
Do it as you breathe out and keep the position for about 30 to 45 seconds. If you have sciatic nerve compression or hernias of up to 6 millimeters in your low back, you can do this exercise.
7 миллиметров.
It helps mobilize your vertebrae if they are a little displaced or rotated.
Немножко мобилизовать позвонки.
Repeat the exercise for the other
Если
side.
они немного смещены или
Do it smoothly as you breathe out.
эту же процедуру на другую сторону. Делаем плавненько на выдохе. Отлично. Также фиксируем.
Great. Keep for about 30 seconds and then go back to the initial position. Okay, now we're going to stretch our piriform muscle. We have already relaxed our pelvic muscles and those of the sacroiliac joint very well, especially if you used Sacrus Physio. And now we can start with stretching the piriform muscle. Before that, we have relaxed it using the device. Take one of your knees. One leg is lying straightened, and you embrace your other knee with both arms and slowly pull to your chest as you breathe out. Then take a deep breath and pull again as you breathe out.
Вот, раз. Потом делаем еще глубокий вдох. И на выдохе еще ближе подтягиваем к груди. Вот, отлично.
Great. Again, keep the position for 20 seconds, maybe even 10 seconds is enough, and return to the initial position. Do the same for the other leg. As you breathe out, hug and pull your knee to your chest as far as you can, and then pull even further as you breathe out again. There, great. Keep it for about 10 seconds so that you not only stretch your muscles, but also felt them stretching. Go back to the initial position. We've just showed the easiest way of stretching the piriform muscle. Now let us show a more advanced variant. It's not suitable for everyone. Those who have chronic pains in the pelvic area or suffers from sciatic nerve compression should only start doing it after the 5th session. Put one leg over the other at the knee, like this. Grab your, in our case, it's right knee, and pull the knee to the chest as you breathe out. You cannot pull it very far now because it is stretching the left piriform muscle. Breathe out and try to pull further. There you go. Then switch your legs and repeat for the other side. Try increasing the amplitude. You can push your leg further from the knee like this. Try that. Breathe out and pull. Good. Do you feel it stretch? Yes, I do. When people have a sedentary work, they feel it. Marina here has such a job, and she feels her piriform muscles stretch. You'll feel the same. Keep the farthest position for 6 to 10 seconds, and then just put your feet back to the initial position. After stretching the piriform muscle, we'll stabilize the lumbosacral area. To do this, hug your bent legs, and as you breathe out, pull them to the chest with some force. Breathe in and out, there, for about 10 to 20 seconds.
И на выдохе будем через легкое сопротивление ног подтягивать их к груди. Вдох-выдох, вот. Где-то так 10-20 секунд. Потом
Then relax a little and breathe in again.
опять делаем вдох.
Then pull them harder as you breathe out.
Посильнее. Вот.
Great.
Отлично.
Thus far, we've worked with the sacroiliac joint, the lower back, relaxed the muscles, and then stretched the piriform muscle and stabilized or fixed the result, as well as strengthened the pectoral girdle.
Дальше уже сделали стабилизацию, то есть закрепление полученного результата и плюс небольшое укрепление мышечного корсета. Иногда вы можете почувствовать некоторые щелчки.
Sometimes you can feel clicks. It's the vertebrae that may well get in their place after this safe and easy mobilization. That's it. Go back to the initial position. You may unbend your legs. Now we'll work with the back of the head.
Теперь мы перейдем к работе с зоной затылка. Итак, берем аппарат.
Take your Sacrus device. We need to relax the opposite end of the spine. With the sharp end, put Sacrus up under the napex. Take your hair from under the device. Put Sacrus under the napex. After doing so, you will feel the spikes almost get into your skull. Put your hands on the wide end of Sacrus and move it 5 millimeters up.
Вы чувствуете, что все шипы, собственно, практически впиваются в ваш череп. После этого вы располагаете руки в широкое основание сакруса и чуть-чуть на 5 миллиметров
There you go.
его смещаем.
Just 5 millimeters, and you'll feel when you're doing it that your neck is stretching a bit, right?
Шея начала чуть-чуть вытягиваться.
We need to keep this soft stretch. That's why it's crucial to exercise on a roll mat,
Важно заниматься,
preferably a rubber one, so that the device would not slip on it and remain in one place.
чтобы аппарат, располагаясь на нем, не скользил, а был фиксирован. Это позволит проводить мягкое вытяжение.
This helps you stretch your neck softly and relax the smaller muscles of the napex and the neck. If you have a Sacrus physio as a part of the bundle, you can press the button to turn it on. Put a wet wipe on, or just do it when your hair is wet. It'll start with a relaxing vibration and then simultaneous stimulation current therapy to relax your nervous system and improve the nerve impulse conduction along the nerve fibers.
Терапия для расслабления нервной системы и, опять же, улучшения проводимости нервных импульсов по нервным волокнам. Даже если вдруг у вас такой объем волос, что он не позволяет...
If you have so much hair that it won't let you run the stimulation current therapy, you can only have it in the sacrum area, because the impulses will go to along the nerve tracts to your legs and up to the brain, so that the entire nervous system will get the necessary stimulation current treatment.
путям, собственно, до головного мозга. Так что вся нервная система будет проходить необходимую микротоковую терапию. Итак, здесь у нас также с вами прошло около 3 минут. Можно сейчас приподнять голову, отложить сакрус в сторону.
Now, it's been about 3 minutes, and you can lift your head and put Sacrus away and return into the initial position. You can also massage your neck if your muscles are extremely tense. Your muscles and your joints are now ready for it. Now, I'd like to mention one more important thing. If you have a neck listhesis or cervical vertebra displacement,
Так, ну все, отлично. Важный момент. Если у вас листез в шее, то есть смещение позвонков шеи, в этом случае мы рекомендуем, когда сакрус, ну опять ставим сакрус по затылку.
we recommend placing Sacrus under your napex again, and as Marina is showing now,
Вот как сейчас.
take a 5 centimeter cushion on the right here
Вот, когда
and
у вас
place it under the middle of your neck.
вы также берете валик.
The cushion will support your neck lordosis and prevent the possible displacement of cervical vertebrae in case of neck instability or listhesis.
Валик будет обеспечивать поддержку лордоза в шее и, собственно, как раз предотвратит возможное там изменение положения шейных позвонков как раз-таки при нестабильности в шее, либо при листезе. Вот. И это в совокупности обеспечит наиболее комфортную
All of
и
these makes
эффективную
comfortable and
терапию.
efficient therapy.
В том-то и фишка, что когда
The thing is, when you
проблемы с
have
шеей
neck instability or neck
стресс
listhesis,
шеи,
you can't
то
use Cordus to
Cordusом
treat the deep muscles of
мы
the
не
neck
можем
directly. You can
непосредственно
put
воздействовать
Sacrus under your
на глубокие
napex
мышцы шеи.
and then Cordus under your collar
Можем
zone.
использовать сакрус под
Put the
затылок,
cushion away and
Cordus
watch.
под
As promised, we're going to show you how to treat your neck with both devices.
Убираем валик. Теперь смотрите. Так, теперь, как мы обещали, покажем максимальную терапию шеи обоими аппаратами. Если у вас
If you don't have neck instability or the listhesis,
отсутствует
that is, cervical vertebrae displacement, in this case, you can combine the relaxation of the napex with neck treatment using Cordus. Use the C side, the one with the spikes and the narrowest one. Put it under the middle of your neck. The treatment is very soft with both of the devices, Sacrus and Cordus.
Обоих аппаратов, как сакруса, так и кордуса. Но при этом вот это комплексное
Yet it is
воздействие,
integral and comprehensive. It ensures a deeper and more efficient therapy, provided you don't have neck instability or listhesis. Normally, 2/3 of people do not have these problems, so they can choose this type of a comprehensive therapy.
могут такой вариант комплексной терапии сразу же совмещать. Сразу же это не с первого сеанса.
Just don't start it from session 1, maybe session 3 or 5. Why shouldn't you intensify therapy right away and only starting with session 3 or 5? Because your body needs to be prepared for the procedure, and a more intensive therapy may also intensify various problems. Imagine your muscles are stiff. One option is we start gradually working on different segments, and the other one is we do 2 areas at once and pretty intensively. The treatment becomes 2 times as intensive, and thus the body reactions may be more acute. That's why you shouldn't start this power therapy right away, and only after 3 to 5 sessions. The worse your initial condition was, the later you should start with intensive therapy. Again, if you have a chronic condition, you must use Sacrus Physio, because you surely need to work with your nervous system. Okay, now it's been 3 minutes. You can put both of the devices away. I don't think it's worth showing. If you wish to take the therapy in stages, during the first 5 sessions, let's show it, you should use your Cordus after the Sacrus treatment and place its C side about the middle of your neck. A key detail for those who have a bad kyphosis or slouching. When you put the Cordus under your neck, it might barely touch the skin of your neck, not to mention sinking into the muscles. In this case, you can simply do this. Get a book about 1.5 or 2 centimeters thick and place it under the Cordus device. This way you can lift the therapy spikes and ensure proper treatment. That's it. You can put Cordus away too. Now we've worked through the pelvis, the skill, and the napex, and we're ready to go further. From the collar zone down to the low back. As we move on to the treatment of the chest area, it's important to put a small cushion under your head.
Итак, теперь мы с вами перешли к
Now we can treat the
проработке
chest
грудного
section.
отдела.
To
Для
do
этого,
this, get a small
приготовьте
cushion
небольшую
about 5
подушку,
centimeters
ну,
thick
где-то до 5
and
сантиметров.
place it under your head.
Положите ее под голову.
This will give you
Это
more
обеспечит более
comfort
комфортную
during the
терапию
chest section therapy.
грудной зоны.
For the chest section therapy,
Так,
use
берем
side
Cordus,
D of the
сторону
Cordus
D.
device.
Для
Place it under your shoulder
терапии
blades.
грудного
Raise
отдела.
yourself a little and
Вот,
get
и
it there.
сначала ставим над лопатками.
Right, that's good.
Немножко приподнимаемся,
And
заводим.
lay down carefully on the
Вот, да, так
cushion.
достаточно.
The Cordus device can shift a little
Плавненько.
because as you place it, it is sinking in between two vertebrae and shifts a little.
Перемещаться. Он так устанавливается, или, скажем так, старается погрузиться в зону между двух позвонков, поэтому он может немножко смещаться. Это абсолютно нормально. Все.
This is absolutely normal. It's fine.
Руки вдоль тела, или
You
можете
can put
положить
your arms
руки
along your
на
body or on your stomach, whichever you like.
Еще раз обращаю внимание на
Watch your
процесс
breath.
дыхания.
Try breathing a bit deeper and slower than usual.
Более
Breathe
плавно
out
и
a second longer than
чуть-чуть
in.
длиннее вдоха. Ну,
You
не
can
прям
count
сильно.
1, 2, 3
Даже прям
in,
считать. Раз,
then
два,
3,
три, вдох.
4, 5,
Идет
6
и выдох.
out.
3, 4, 5, 6. Еще раз. Раз, два, три. И выдох 4, 5, 6, 7.
Again, 1, 2,
И так вот
3
плавненько дышите,
in,
желательно
and
дышать
4,
животом.
5, 6, 7
Такой процесс
out.
дыхания расслабляет
Breathe
нервную систему,
slowly and
помогает
use your
лучше
stomach.
расслабить
Breathing like this unwinds your nervous system and helps relax the muscles that run along your spine.
все напряжены.
They must be all tense. We
Терапию мы
treat
с
the
вами
key
проводим
sections of
по
your
зоне
spine
позвоночника,
where the tension is at its
там,
highest.
где напряжение
The
обычно
treatment of
в
every
большей
section takes about
степени
3 minutes.
сконцентрировано.
This is just enough to exhaust your nerve center that
Помимо
regulates the
также
muscular
процедура
tone,
занимает
and the
порядка
muscles
7
yield
минут
and
отдыха.
relax. Then they stretch
Именно это
slightly
время
to allow the
позволяет как
device
раз
to sink deeper.
утомиться
Many
нервному
people
центру,
notice
который
this. They lie for about 2 minutes, and then they feel the device goes deeper. This is the moment when the muscles relax. Right after 3 minutes, you can sit up. Yes, you can use your elbows.
Чуть-чуть более глубокого погружения аппарата. Многие, кстати, так отмечают, что лежало около 2 минут, потом раз чувствую, что опа, и аппарат стал как будто глубже погружаться. Вот это момент как раз расслабления мышц. Теперь, для того, чтобы, вот, как только у вас прошло 3 минуты, можно приподниматься, да, прямо садиться, да, опираясь на локти. Перемещайте где-то на...
Then you move your cordus a palm length lower and deeper. And then again, you prop yourself with your elbows and go down to the area between your shoulder blades. You won't reach this area until about the 5th session, but we'll show it right now. The device is exactly between the shoulder blades. You can lift your arms and spread them. You can see here that the device is exactly between the shoulder blades. You can go back and put your arms comfortably.
Находится как раз в зоне между лопаток. Вот. Ну, обратно можно как удобно, комфортно руки расположить. Кстати, именно в этом положении руки лучше расположить крестом. То есть в стороны разведи. Марин, вот так, вот, да. Так мы лучше раскрываем грудную.
In this position, it's better to make a cross of your arms. That is, spread them to the sides. Marina, can you do it? There you go. That's how we open our chest. The area between the shoulder blades is the most uncomfortable for many people because the muscles there are very tense. They're tense due to a static load from sitting at the computer or at the table. At the same time, your suppressed emotions also stiffen your muscles in the shoulder blade area. All your worries also concentrate around this area. It is especially sensitive with women because they are more emotional. You need to keep it for about 3 minutes. Don't be scared if you have some acute pain. It's probably because of a hernia or a protrusion. If this is the case, just raise yourself a bit and move Cordus to the lower back a little, to the lower section of the chest, where it'll be more comfortable.
И чуть-чуть смещаете кордус ближе к пояснице, то есть в нижнюю часть грудного отдела, там, где вам будет более комфортна эта процедура. В некоторых случаях, например,
in some cases, foreign specialists suggest putting a book under your pelvis instead of a cushion under your head. This can reduce the depth to which the device sinks into the chest muscles and makes the treatment more comfortable. The Cordus device has elastic therapy spikes that can adjust to your muscular tone. First, they flatten a bit, and as your muscles relax, they slowly recover, which makes this model comfortable and efficient for this therapy. That's how it adjusts to the tension of your muscles. Some may feel it's a bit uneven. It's pressing more to on the right side and less on the left. This signals about the muscle spasms. If some muscles are tenser, you may think that the device is higher under them because there's more pressure, even though the therapy spikes are adapting. It's just because your muscles are very tense, but in 2.5 or 3 minutes, you'll feel that the device became more even and more comfortable for you. 3 minutes are over. Now sit up slowly, propping on your elbows, then move the device another palm length down.
Это просто говорит о том, что у вас достаточно такая яркая проблема спазма мышц. Но через 2,5-3 минуты вы почувствуете, что как будто выровнялось положение и вполне комфортно уже начнете себя ощущать. Итак, 3 минуты.
Right, that's about it. That's your lower chest section, or the diaphragm projection. As you might know, Sacrus can be applied to the diaphragm. We'll show it at the end of the therapy. Right now, we're working with the lower section of the chest, or the diaphragm projection from the back.
Как вы, может быть, знаете, сакрус используется на диафрагму. Это мы покажем приблизительно в конце уже терапии. Вот, сейчас мы прорабатываем нижнюю грудную зону, вот, или проекцию диафрагмы со стороны позвоночника.
The diaphragm is attached to the spine and the breastbone, and it basically overlays the lower section of the chest. You use your diaphragm when breathing, but that's not its only function. You might not realize it, but it also regulates your emotions and even has an indirect impact on your digestion and blood pressure.
Может быть, для кого-то будет открытием в регуляции не только дыхания, но и еще эмоционального состояния человека, а также влияет даже, хоть и косвенно, на процессы пищеварения и давления.
For example, if your blood pressure increases after a heavy dinner, or you get a feeling of anxiety, this can be associated with your stomach expanding or lifting and compressing the pneumogastric nerve, which is located nearby. It restricts the diaphragm movements and causes this anxious feeling, as if something is compressing one's chest. If you have this symptom, you can just breathe with your stomach.
В общем-то, немножко создает такую тревожную ситуацию для человека, как будто что-то в груди сдавливает. В этот момент вы можете просто глубже подышать животом. Ну, а мануальные терапевты и там остеопаты.
Some chiropractors and osteopaths, including myself, can just press their fingers under the rib arches and massage the area around the gallbladder and the ventricle, thus allowing it to go down a bit. This procedure takes just 2 minutes and helps relax this area and get rid of the anxiety or even gradually reduce the blood pressure by 15 to 20 millimeters of mercury.
Постепенное снижение давления там, на 15-20 миллиметров ртутного столба. Мы все равно записываем. Так, приподнимаемся, отводим аппарат в сторону. Вот. Ложимся обратно. Сейчас будем делать небольшой
Now let us
круг.
lift, move the device to the side, and lay back. We're about to do some little twists. After we work through the chest section, we can do another set of twists to mobilize the lower chest section of the spine. Now you need to put your arms in front of yourself, the way you did at school. Yes, like this. Then move your knees to one side, almost touching the floor, and your head and arms go to the other side as you breathe out. There, we slowly mobilize the chest section, while also involving the low back. Keep the position for 10 seconds, and return to the initial position. Then repeat the exercise for the other side. Do the twists as you breathe out, and try breathing out longer than normal. Now return to the initial position. We've worked with the neck and the chest section, and it's now crucial to stabilize this part of the spine. To do so, lock your fingers together and grab your napex, then pull and bend your head forward, almost touching your chest with the chin. Many of you will just touch it. Breathe in, and again bend your head as you breathe out. Keep the position when you touch the chest for 5 to 6 seconds. You can force your head back a bit. This exercise helps you strengthen your pectoral girdle, and if necessary, stabilize and mobilize your cervical and dorsal vertebrae. That's it. We go back to the initial position. If you didn't put your Cordus device under your low back when treating your pelvis, which is a rare case, note again that you should do it after the 5th session. Then after relaxing the chest section, you should put the L, or the widest side of your Cordus, under the middle of the low back at about the navel level.
Вот если у вас там, допустим, достаточно болезненно, можете смещать ниже либо выше, там, где более комфортно.
If it hurts there badly enough, you can move the device up so that it was more comfortable. First, place your legs, try keeping them straight, and then lay down carefully. Good. Relax. The device may shift a little to fit exactly between 2 vertebrae. Your buttocks must touch the floor.
Важно, чтобы попа ваша касалась пола. Обращаю внимание, что опять, если у вас листез, нестабильность, да, в пояснице, опять же, если у вас...
Note that if you have a listhesis or low back instability in this very section where you're applying the Cordus, or the Schmorl's node of over 5 millimeters, a cyst of over 5 millimeters in this section, and as I already said, a listhesis or a recent injury, for example, less than a month ago, or maybe even a compression fracture, even an old one, and you had an MRI or X-ray, and know that you had an L3 compression fracture of the 3rd and 4th vertebra.
Или был даже пусть и давно компрессионный перелом, ну, например, вы по МРТ знаете, что или там по рентгену, что у вас компрессионный перелом там L3, да, к примеру, там 3-го, например, 4 позвонка, то, естественно, в середину поясницы вам ставить нельзя.
In this case, you cannot put the device under the middle of your low back. So skip the problem areas like hernias of over 6 millimeters, Schmorl's nodules of over 5 millimeters, cysts of over 5 millimeters, hemangiomas. Skip such areas and place the device either above or below them. This way, the therapy will still be effective, but it will not aggravate the previously mentioned conditions. Clock the same 3 or 4 minutes. After about 3 sessions, you'll be able to cope without any clocks or stopwatches, because you will be able to tell that 3 minutes passed, as the tension in your body starts to relieve. Gradually, this relaxation effect will come faster, and after the 5th session, you'll learn to relax your muscles, and it will be easier for you and faster, just some 2 to 2.5 minutes. Now, during the first sessions, you might sometimes need up to 3.5 or 4 minutes. Now, if you have chronic pains or problems and it's hard for you to lay down on the device, you can put a towel on it during the first session to make the treatment as comfortable as possible. To stand up or to intensify the therapy, you need to bend your legs, put them at an angle in front of yourself, feet at shoulder length, knees pressed together, or if you're lying next to a bed, you can put your legs on the bed and work with your low back section for about 2 minutes.
И также еще проработать поясничную зону где-то в районе 2 минут. И сейчас вместе с Мариной сделаем.
Right now, Marina and I will show the intensified Cordus treatment for the left and right intervertebral muscles. This is especially beneficial if you have scoliosis.
Особенно эта тема актуальна в случае, если у вас, например, сколиоз.
Now put your feet together. Do everything slowly. Right. Put your hands on your chest and slowly turn to the left. Knees and arms should go together. Let's try it. That's how we intensify the impact on the paravertebral muscles on the left. Keep this position. As you can see, it's about 45 degrees.
Плавно попробуем. Вот, да, так мы усиливаем воздействие на мышцы с левой стороны, паравертебральной. Фиксируем такое положение. Ну, угол, как
Keep it for about 30 seconds. Make these turns after the 3 minutes. They have some good impact on the left and right paravertebral areas. Then return to the initial position slowly. Take a deep breath, and as you slowly breathe out, turn right.
И на длинном выдохе плавненько поворачиваемся направо. Постепенно чувствуя, как
You will gradually feel Cordus sink deep into the intervertebral muscles on the right. It is a key procedure for those with scoliosis, or if you feel that your low back muscles need more exercise. At the 6th or 7th session, you might feel that everything became easy for you, and you can intensify the therapy in this way.
на 6-7 сеанс вы чувствуете, что уже все достаточно легко, поэтому можно усилить терапию вот таким вот способом. И возвращаемся в исходное положение.
Return to the initial position. To take the device out, you can just turn on one side a little and use your other hand to grab it and place in front of yourself.
Собственно, спокойно его достать. Вот, отлично. И положить перед собой.
If necessary, if one of your vertebrae is often regularly displaced, say a lumbar one, or if you feel some instability in your low back, or it starts aching in the evening, you might need some extra stabilization of the low back section, even if you've already done it. So bend your legs, hug your knees, and pull them to your stomach as you breathe out. Your legs can resist the movement a little.
И плавненько на выдохе подтягиваем их к животу через легкое сопротивление ног. Все, делаем это 2-3 раза.
Do it 2 or 3 times and return to the initial position.
И потом уже
That's it. Unbend your legs.
Все, ножки выпрямляем.
Thus, we've worked on your pelvis, napex, neck, chest, and low back sections. In other words, we performed a comprehensive treatment of the entire spine from head to coccyx.
Комплексную терапию всего позвоночника от затылка до копчика. Теперь мы с вами
Okay, now let us finish the comprehensive therapy with some stretching exercises.
на растяжку.
Put your arms behind your head and pull at your heels. That's right, heels. There you go. Great. Push your heels forward to stretch the muscles at the back of your legs and the low back, as if pushing an invisible wall. Stretch your arms back as you breathe out. Take a deep breath and stretch yourself as far as you can, as if spreading walls in front of and behind you. Repeat 2 or 3 times.
Делаем так 2-3 раза.
This will give you some extra stretching and align your vertebrae after the deep treatment. Now there's one final exercise for us to do. It's basically the same, but now we'll move like a snake from side to side as we stretch. Right, use your legs as well, to the left and right. It also helps you mobilize your vertebrae a little, ensure their proper movement, and improve spine joint lubrication. Now, some people ask if it's necessary to take cartilage protectors. I believe that any cartilage protector, the one that we produce from the cedar tree inulin, and some herbs, or the pharmaceutical glucosamine and chondroitin, they only work when you receive a proper treatment of the key areas of the spine and activate the blood circulation in them.
Кровообращение, тогда эти питательные вещества будут туда поступать. Если вы просто их пьете, то они будут почти бесполезны. Вот такая ситуация.
Then these nutrients will reach their destination. If you just take them, they will be almost useless. Now, after we've done the entire spine, we have just one Sacrus procedure to perform. You can skip it, but if you have problems with your neck, or chest pains, or if you have high anxiety levels, you take your Sacrus, place its upper end under the breastbone. Feel for it, find the solar plexus under the breastbone, and put the device to the soft area there. To do this, lay down on your stomach, use arms for support, and slowly move the device. You can adjust it by hand to fit exactly under the breastbone. Your initial position is sphinx-like. Rest on your arms and slowly lay down. Try breathing deeply with your stomach. Breathe in slowly and slowly breathe out. Some people cannot lay down at once, so you can use your hands for support like this. You don't have to lay down completely on the device. If you cannot lay down at the first session, you'll do it by session 3 to 5, just like Marina here right now. Further on, you might completely move your arms to the sides and back, just back along the body, and lay them down. This is the best position you need for the treatment of the diaphragm area. Now, why do we need to treat the diaphragm? Firstly, to improve your breathing, to ventilate the lower section of your lungs.
Для улучшения функции дыхания, чтобы вентилировалась нижняя часть легких. Слава Богу, благодаря ковиду многие из нас узнали, что легкие желательно вентилировать полностью. Для этого нужно дышать животом.
Think COVID. Many of us learned that they should ventilate their entire lungs by breathing with their stomachs. Now we're ventilating our lungs entirely in order to reduce the risk of respiratory diseases. Secondly, the diaphragm is connected to anxiety. So if we work with it, relax it, we'll have lower levels of anxiety and avoid panic attacks. Thirdly, the diaphragm can impact the relaxation and digestion, and even reduce blood pressure. That is why its good condition can help you improve your breathing and normalize your nervous system, emotions, and improve the condition of the abdominal cavity. We're performing a visceral massage using Sacrus. It's not just about diaphragm relaxation, but also a soft visceral treatment of the abdominal cavity.
Висцеральный массаж проводим сейчас с помощью сакруса. Не только, собственно, расслабление диафрагмы, но и мягкая висцеральная терапия брюшной полости. Кстати, данная процедура также улучшает и лимфодренаж, потому что часть лимфы проходит, собственно, вдоль брюшной стенки.
This procedure improves lymphatic drainage because some of the lymph runs along the abdominal wall. Unlike spine correction, you can perform this procedure every day, both in the morning and in the evening. You'll need about the same 3 minutes to relax. You can increase this time to 5 minutes after several sessions. The treatment course comprises 8 to 10 sessions. Then take a break for 1 or 2 weeks, and take the treatment as you feel necessary. If you feel that there is tension in your chest, or you've had some stress, or you just want to relax, you can perform this procedure at any moment. Okay, we're done with the comprehensive therapy for today. Thanks for watching and subscribe to our channel. Stay safe and sound.
Сегодня закончено. Спасибо за внимание. Подписывайтесь на наш канал. Будьте здоровы.